Thank you. We're ready to take questions from the committee. Nick, please.
Yes, thank you very much for your presentations. Very much appreciated. I'm going to direct this question at Dr. Stoody, but just to make sure I have this clarified in my own mind, we heard earlier from Dr. Millen there were 82 scientific questions. And out of those 82, one of them you just discussed, that work group 2 had this clustering question around dietary patterns and lifestyle issues. And that particular question also had several questions that were prioritized into a set that was answered. So my question is, do I have that right, that path? And secondly, what were the criteria to actually prioritize these multiple questions? Were those criteria set a priori? And were they presented to the full DGAC at a public hearing?
So first, related to the dietary patterns topic. So the number of questions, or this counting of the questions is a little bit tricky. So for example, and I'll use the topic of dietary patterns in cancer as an example. So the advisory committee in their report, as counted as one of those 82 questions, their report literally has in Subcommittee 2's chapter, Part D, Subcommittee 2's chapter, it has the list of questions that they addressed. There are a number of questions there, but one of them is dietary patterns. What is the relationship between dietary patterns and the risk of cancer? And then under that were 4 types of cancer. So that one of the 82 is actually 4. Yeah. So this numbering is a little bit, it's complicated. And so when I was talking about the dietary patterns topic overall, I was actually talking about how the Subcommittee 2 looked at dietary patterns in health. There was actually dietary patterns that were considered, other aspects of dietary patterns that were considered in some of the other subcommittees. And so my discussion was really limited around that one topic. And we could certainly help with that clarification around accounting or talking a little bit more about how those other questions were addressed across the subcommittees. In terms of the prioritization, actually Dr. Millen included in her slides the criteria that the topic selection and refinement criteria, prioritization criteria. And those were around the public health importance, whether or not they could potentially help inform public health guidance, the burden of that disease. So they had those criteria. I think there were around 6 to 8, and they are definitely in her slides. They were presented at a public meeting, and I don't know if it was the first public meeting or the second public meeting, but early on in the process they were discussed.
Thank you.
Yes, Dr. Lau.
It's Joseph Lau. The question is directed, I guess, to both of groups. Dr. Chang, the process of identifying questions and then being carried out for systematic review in the AHRQ process and the DGA process is somewhat different in that in the DGA, the committee served both as a formulator of the questions, deciding the criteria and interpreting the results, and then writing it up. Whereas in the AHRQ's EPC process, the question is being solicited from at large from the community, and then it's vetted by another group before it's being carried out by the evidence review team. And the conclusion is just that conclusion without making recommendation. So in contrasting the two different processes, it appears that the DGA kind of served both as a prosecutor, the judge, and maybe jury at the same time. And I just wonder, would you comment on this contrast?
Yeah, so I noticed that as well. I haven't been as intimately familiar with the DGA process. I'll say in our ARC process, I'll just outline the reasons why we do the things we do. That first step of the topic refinement, we feel like it's important to have that partnership of the end user as well as the methodologists who are well-versed in the systematic review process. And so I think that having the systematic review expert who's going to do the review driving that process is helpful because and then having that kind of close interaction with the end user, understanding what the question is, and then helping them develop the question. Could it be done the other way? We have done it the other way, where the end user, usually a federal agency, comes up with the questions, and maybe there's slight tweaking as needed with the systematic reviewer to make it more evidence, more easier to be translated into a systematic review process. But that beginning step is really the partnership. We do feel like the actual systematic the conduct of the review, the development of the protocol, the deciding of what types of studies are going to be included, and then the method of analysis, and then doing the analysis is important to be done by the systematic review experts because they have the expertise in that, and also that it should be done in an independently and by people who do not have a stake in judging the evidence. So in that way, we do feel like that kind of that middle process of the looking at the evidence and summarizing it is important to be separate from those who are going to be using it and then making judgments on that. And people can look at the same evidence, and it's a transparent process, and they can say, well, we disagree with this analysis, and the committee can end up making a separate decision or something that maybe doesn't exactly support the evidence, or maybe they can say, well, it's because we didn't agree with this analysis, or they can say, well, we agree that the evidence was strong or weak, but because of these other factors, we make a different recommendation. But we do feel like that's important to have that separation.
And I'll start with a few comments. So for our advisory committee process, we are asking the function of our advisory committee is to provide advice to the federal government around the current state of nutrition science. And so we have taken that as an approach of allowing them to determine what are those topics that there is growing or new advice that would help inform federal policy. So that said, that's why our process has been as it is. We charge them with looking at the current guidance, based on your expertise, what are those areas that the advisory committee feels deserves additional review? That said, I do think that, and we have talked a lot about and have tried to really build in what are ways that we can identify, we can do some of that on the front end, not necessarily the questions that need to be addressed are A, B, and C, but more what are those topic areas that, what are those topic areas that we feel like the advisory committee would most beneficially, spend their time and the expertise that's needed. So we have talked about the need and a desire and looking into how can we better do some of that work up front. The topic development refinement process, as has been discussed, is a very long process. And so if there is some upfront work that could be done before we have that advisory committee in place, and I will say we do some of it now, but it could potentially be expanded, upfront work that help inform that advisory committee that could then help kind of in the full process. That front piece is time intensive. In terms of the end users, so the end users of the advisory committee's report is our federal agencies. And so I will say that not as a part of the advisory committee process, but within our federal family, we do have opportunities where we talk to our other agencies. So, for example, we have an interagency committee on human nutrition research, subcommittee on dietary guidance, the ICH&R subcommittee on dietary guidance. After every public meeting, we brought that group together to talk about what the advisory committee was doing. So it's not as though the end users were not engaged in the conversation, but I will say we didn't have really, they were going in the direction of dietary patterns and the topics they were going in, there wasn't really no, dietary patterns aren't relevant, or we didn't really have a lot of feedback that made it seem as though the stakeholders were in opposition to what was being addressed. So the stakeholders are engaged throughout the process. In terms of the last point that Dr. Chang made around who reviews the evidence and then who makes the recommendations, So our advisory committee is, again, reviewing the science and making a technical report around the state of current science. That document is then provided to the federal government, who then, and the policy writers are often, or the dietary guidelines writers are often involved in some level of knowing what's happening with the dietary guidelines, but those individuals are different than those who were involved in reviewing the evidence. So it's a different, so those making the recommendations aren't the ones who actually make the final recommendations in the dietary guidelines, aren't the ones who actually did the review of evidence. We do have, in the development of the dietary guidelines, we involve some, as we talked about, peer reviewers from the advisory committee process. We also involve some of our NEL staff to ensure that the systematic reviews are accurately represented, the science is accurately represented in the dietary guidelines, but they're at kind of a review process versus in taking those systematic reviews as well as the other sources of evidence and making the final recommendations.
And Dr. Sepulveda and then Dr. Ross.
Martin Sepulveda, I want to extend my appreciation as a process engineering and a quality management person on your deployment of those tools and technologies in doing the kind of work that you do. It's quite impressive. My question is around the concept of public health importance as a criterion in a number of steps in these processes. And as someone who has spent an enormous amount of time sitting in committees trying to make decisions about public health importance, the part of it that isn't clear to me is not the impact and the population, elements of public health importance. It's the elements that relate to feasibility, to data and information requirements, to dependencies. What has to change, for this thing to ultimately influence the outcome, and certainly not least is what are the costs, and what are the trade-offs that are associated with the cost, that if we decide to pursue A versus B versus C are. Can you talk a little bit about that? And it's open, I'm looking at Eve, but it's really open to everybody.
So I think it's a great question, and it's not something that's currently in our framework, and I think it's an entirely different thing. And I think actually Dr. Rasmussen will be talking about the recent WIC food packages, and they do have kind of this, I don't know what it was, kind of a different kind of impact amount analysis, a cost analysis. I think I've heard you, Dr. Rasmussen, note that it's a different way of thinking, and we haven't done it before. I think we can hear more about it today, and be interested in hearing any recommendations and reactions around that. One of the things I do think is tricky is that the evidence we have around that, and so for making a change in some aspect of diet and the cost implications, I don't know how well that's captured now, and what it would mean to do that, what the potential, is the cost related to health, and how is that measured, and who's measuring it? And so we would definitely be interested in hearing about that, but right now, we would need more expertise in that area.
Dr. Ross.
Okay, thank you. Catherine Ross. So the presentations were very helpful in clarifying about the NEL process and systematic reviews, but I wanted to go back to a comment that Dr. Millen made earlier. She said about 25% of the 82 questions were NEL addressed, and about 35% de novo data analysis. So I wondered if you could comment a little bit more about what were those other questions, and then there's another 40% in here somewhere, and how are they addressed? So considering all of the questions together, which types of approaches were appropriate for what kinds of questions? I guess that's my basic question.
So the 82 questions, as in response to Dr. Pronk, some of those one questions were multiple questions, sub-questions. And I think that was particularly true for some of the NEL questions, where it would be one overarching questions, but actually several sub-questions. The 4 methodologies that were used across the board, so in terms of what are the other approaches, they were original NEL systematic reviews, use of high-quality existing systematic reviews and meta-analyses. Did I say NEL first or existing? NEL systematic reviews, high-quality existing systematic reviews and meta-analyses, food pattern modeling analyses, and data analyses. And Dr. Britton will talk about food pattern modeling and briefly about data analyses later today. So those were the 4 methods. So when she was talking about those percentages, the other pieces would be coming from food pattern modeling and existing reports. In terms of, so the 25%, yeah, I mean, it is tricky. The one question could really be multiple questions, and I think we probably need to do a better job of helping to communicate that total number within the sub. I mean, one food pattern modeling question is one question. It's not a number of sub-questions. So, so those were the 4 methods. We can, in the advisory committee's report, in the methodology chapter, they actually talk about that 25%, those different percentage breakdowns and how they were used. But I do think it is something that, to really look at that, we need to talk more about the sub-questions within the questions to really get a good feel for how those questions were divided across the different approaches.
Dr. Sim.
Yes, Barbara Schneemann. Just to follow up in this area, I'm wondering if you can give us an example of where an ARC review might have been used as one of the systematic reviews.
As Dr. Millen noted, so there was the topic of dietary patterns and risk of cardiovascular disease, and NHLBI had actually done systematic reviews on that topic that were then used to help inform the American Heart Association, American College of Cardiology recommendations around cardiovascular disease. So the question of what is the relationship between risk of what is the relationship between dietary patterns and risk of cardiovascular disease was addressed using those NHLBI systematic reviews, as well as some other existing systematic reviews on the topic. ARC reviews, do you remember which age? I don't know if we had, in 2010, there was vitamin D, an AHRQ vitamin D systematic review that was used and I think it came out right before the 2010 report did, so I think they referenced it, but it was used in helping form the 2010 dietary guidelines. So vitamin D is definitely one. We don't have as many kind of general food-based systematic reviews that we use that are available through HRQ. But vitamin D was definitely one we used.
The other one that comes to mind is that for added sugars, the committee did use some WHO systematic reviews that were available on that topic as well. So, another example of
Dr. Boucher.
leveraging a different.
Yeah, Speaker Carol Boucher. Thank you, all of you. Stephanie, my question's for you. In your steps, you had ensuring appropriate context. And under that, you had engaged stakeholders and partners. So I was wondering if you could give some examples as to who are the stakeholders and partners and how do you engage them?
So as I alluded to, throughout the process, I used to have this slide where I have kind of a triangle, an upside down triangle, and I think the beginning steps are most important to engage the different stakeholders, both the end users, so the people who are going to be using that systematic review to make recommendations, other people, the content researchers in the field, research experts in the field, clinical persons who are going to be carrying out the policies. So we engage stakeholders at quite broadly, anyone who may have or a stake basically in the outcome of what the systematic review is used for. So we engage them primarily in the topic refinement, so in deciding the question, and then also in the protocol development. So we have what we call a technical expert panel, where we invite the research experts as well as those who will be using the report to provide input into what type of the research studies will be most helpful, what are the studies out there, what can we expect, what are the outcomes, what are the linkages to help kind of frame the systematic review. So we engage them at all different levels. We call them different terminology. I didn't want to get too much into the weeds of it, but key informants at the determining the question level and technical experts at the determining the protocol level. So it's throughout the process, and then again at the peer review level. Did that answer your question? Kind of get at it.
I have, excuse me, Jane. I have one question. You mentioned, it's been mentioned many times, of using past reviews, systematic reviews, high quality ones. Is there a framework for judging when there's overlap of past systematic reviews, of how you make a decision on which ones or which one to use? If they're both high quality, but there's overlap, but different papers have been used, and how do you do that? How do you work with that?
I can maybe start, but I'll just say that overlap is definitely looked at. And so when systematic reviews are used as a source of evidence, there are literally spreadsheets developed with, the systematic review by this group. These are the studies that they included. These were the criteria that they had. Systematic review by this next author. These are the studies they included. We completely check to see how much crossover there is so that you don't kind of overrepresent the literature that's there. Do you want to?
Yeah, and I think it's sort of up to the committee then how they ultimately decide whether or not they want to just rely on one of those reviews or whether they want to rely on both the reviews. There may be some nuances covered by one review that aren't totally addressed by the other review, but then to very transparently describe where there is that overlap and then not double count that overlap and make it appear that the evidence is stronger than it really is.
Should there, I guess I'm coming from that point, should there be a framework of decision set up beforehand rather than leaving it up to the committee to decide kind of on an ad hoc basis which one to use or how to combine them or whatever, or weight them?
I think that's one of those things where ideally you'd love to have a framework set up, but in so many cases it really depends on the question you're addressing and the reviews that you're faced with, that it's a little bit hard sometimes to predict upfront how you can sort of handle all of those situations. So I think what we've done is put a process in place to acknowledge that you need to consider the overlap, you need to consider the quality, you need to consider the inclusion-exclusion criteria they used, and that you need to very transparently describe why you chose a particular approach and how to combine the evidence.
Thank you. Jamie, next. And then.
So my question, Jamie Yard, my question is maybe sort of a step above that. Should the DGAC even be involved in deciding that prior systematic reviews should be used? So should that be the purview of an independent, maybe someone from NEL, who looks at the literature and says, well, there's adequate number of systematic reviews that address this question. We don't need to do that, or this does not have an adequate literature to answer the question, and the NEL should proceed with the literature review from a transparency and perception of cherry picking the literature. What's your thoughts about that?
Yeah, that's it. So we do actually have a step in the process where we will begin the search process by looking for existing systematic reviews and meta-analyses, creating an inventory of all of the ones that are out there that meet sort of the basic criteria of the committee. And so it is a formal literature search that will identify all existing. So it's not necessarily a cherry picking process. It was a formalized search to identify every potential that then could be used to inform. And then it's a process of going through and making sure that those existing ones are meeting those a priori criteria, and whether or not they're asking the exact question that the committee is answered. So that is asking. So there is sort of a formalized process that is in place in order to make sure that they're comprehensively looking for all of what potentially could be existing, and not just saying, oh, you know what, we knew that report was done, so we'll just use.
And I'll just quickly add, too, we're in a bit of a unique, and this last time was the first time we had so many existing systematic reviews and reports and meta-analyses available. So in 2010, there were there were some systematic reviews, but I think we're now in a space where there's more. And so it is something this advisory committee, very early on in the process, talked about how do we go about this new, this is really a new area, a new methodology. And so this process that was used, using AmStar, doing a formal search, having criteria for the reviews that they would use, that's something that really came to be because we're in a situation where we have the availability of them. And so, I think the process continues to evolve each time, and I think that's something we continue to look at.
We have time for one quick question and one quick answer before our break.
Okay.
Dr. Krebs-Smith.
Thank you. This is Sue Krebs-Smith. I'll try to make this quick. It's in follow-up to a question that Joseph had asked, and Eve, that you had said that it really was a charge to the committee to be identifying what the questions were, or that was sort of part of their mandate. But given what Dr. Millen had said earlier about how lengthy a process that was to come up with the questions, and then Stephanie, you had indicated how it's important to have the stakeholders and the methodologist involved with the development of the questions. I wonder whether you could both address what might be lost, or do you think something might be lost if instead of the committee doing it, if more of that work were done up front by the stakeholders being the agencies plus the methodologists, say with NEL, and so that when the committee comes in, the questions are formulated. Maybe more, you sort of suggested maybe the topics could be identified, but do you think it could go the next step to the questions, or would something be lost in that process? Maybe both of you address that. Thank you.
I don't think I spoke to that very eloquently, but yes, that's what I was trying to get at, that if we could have some of this piece up front. We do, I know we said this a number of times, but we do operate within the realm of the Federal Advisory Committee Act. So we ask them for advice. I don't know if there is a mechanism in which we could literally hand them over a series of questions, or, I think we would need to determine how that would work. I think that, because they are an independent committee, we are asking them to provide advice. So I think that's something we would need to investigate. I definitely think, we do charge them. We do have kind of our charge, as has been talked about quite a bit this last round, is rather broad. Is there the opportunity to really have a more refined charge and have some people involved in clearly outlining what that scope of activities are. So I think it's certainly, there's opportunity to do more up front, whether it's at the topic level or going into the question level. I'm not sure. And I think we would have to work with there are a number of federal advisory committees, so having an understanding of how we can operate within that space, which I don't know the answer to that piece.
I think the challenge.
Thank you. I'd like to thank our all-morning speakers and our committee. I'm sorry?
Oh, it's okay. I was just going to say.
Oh, I'm sorry, Stephanie. Well, 1 minute. We have a 10-minute break coming up.
Well, I don't want to keep people from the break. I was just going to say the challenge is the DGAC is in a unique position in that I was struggling to find whether you were actually the people writing the evidence report or you were making the recommendations. And in a sense, you're doing both. And I think that's the struggle that I see, is that the federal agencies are the end user, or is the DGAC the end user of the report? And that's something I haven't quite pieced through. So, and I have an answer. Sorry.
Again, we have a 10-minute break. I'd like to thank everybody, the committee as well as one speakers. Thanks very much. We'll be back in 10 minutes.